Students, so today we will discuss about role of nurse in oxygen therapy. So oxygen therapy is administered because oxygen is higher concentration than the atmospheric air. It is used to treat hypoxia and respiratory distress. So whenever there is low oxygen in a human's body, we generally administer oxygen. It also helps to maintain adequate tissue oxygenation, and it is essential in emergency and critical care settings like in ICU, OT, in emergency wards. Okay. Next, we will discuss what are the indications of oxygen therapy when we are going to administer oxygen to the person or patients. When there will be low saturation level below 90%, that is hypoxemia. Then respiratory distress, when the person is unable to breathe. Then chronic obstructive pulmonary disorder. Then pneumonia. In cases of pneumonia also oxygen is required. Asthma attack, cardiac disorders, shock and trauma, and post-operative care. So in these cases we generally administer oxygen. Next, we will discuss about the objectives of oxygen therapy. So, the goals are to improve oxygenation, reduce work of breathing, prevent tissue hypoxia. So, if we administer oxygen, the tissue will get proper amount of oxygen. Then decrease cardiac workload and promote patient comfort and maintain normal oxygen saturation level, that is 90 to 100% is the normal saturation level. Now, what are the devices used to deliver oxygen? The first is the low flow devices the first one is nasal cannula, or we can also say nasal prongs, that delivers 1 to 6 liter of oxygen per minute. The next one is simple face mask, that is delivering 5 to 10 liter of oxygen per minute, and the partial rebreather mask that will deliver 6 to 10 liter per minute. And the high flow devices like Venturi mask, it have different color, according to that the oxygen is administered to the patient. And non-rebreather mask, that is NRBM we say, and mechanical ventilator. When the patient is unable to breathe, the GCS is low, generally mechanical ventilation is given to the patient. Now you can see by the images that nasal cannula or nasal prongs is giving 1 to 6 liter of oxygen per minute, and the concentration is 24 to 44%. In simple face mask, you can see it is delivering 5 to 10 liter per minute and its concentration is 40 to 60%. Venturi mask, as I have already discussed, it is having different color. You can see the colors here, and it is delivering 4 to 12 liter per minute and its concentration is 24 to 50%. And NRBM, that is non-rebreather mask, where it is having a reservoir in it, and it is having a concentration 60 to 95%. Now next, priority nursing assessment. So assessment before oxygen therapy, we need to see the airway patency. The patency has to be checked, otherwise the delivery of the oxygen or the goal for which we are delivering will not be satisfied. Next is respiratory rate and pattern. We have to assess it before administering. According to that, we will give whatever the whatever the mask required, type of mask required. Then oxygen saturation, according to the saturation level, if the patient requires only little amount of oxygen, then it can be managed by nasal cannula. If the patient is requiring more amount of oxygen for longer period of time, then maybe mechanical ventilation is required. So according to that, we have to check the saturation as well. Then breath sounds, okay, in pneumonia patient or in asthma patient, you can find different sounds. According to that, we have to administer. Then skin color and cyanosis. So what is cyanosis? I think you have some idea. That is bluish color which turns due to lack of oxygen in body. That is, it can occur in the periphery or in the central part. Central part means in tongue, lips, and in periphery means in the nails, in the hands and legs. Okay, so we have to assess the skin color. Then coming to vital signs, we have to also check the vital signs and level of consciousness. So if the patient is having low GCS, that is Glasgow Coma Scale, normal is 15. And if the patient is having low, like below 4 or 3, then obviously the patient has to be kept in ventilation, and according to that we have to administer oxygen according to the level of consciousness. Then coming to the part nursing management. During oxygen therapy, verify physician's order. We must check and recheck repeatedly the physician's order. If the patient is COPD, we will not give much amount of oxygen. Okay. Then select appropriate oxygen device. Which way we will administer the oxygen. Position patient in Fowler's position. Whenever the patient is having breathing difficulty, we will first, before administering oxygen, we have to give a Fowler or semi-Fowler position, that is kind of a sitting position, so that the size of the diaphragm will increase and the patient will get more amount of oxygen or space. Then ensure proper fit of mask or cannula. There should be no leakage whenever we are giving mask, or in case of cannula also, it should be placed properly. Otherwise, the objective will not be satisfied. Then monitor oxygen saturation. We have to monitor the saturation whenever we are administering, before and after and during the period of administration. Assess respiratory status regularly. So we have to keep on monitoring the patient. Then what are the safety measures we have to take? Like no smoking near oxygen source, because oxygen is a source which can create or which can help to cause fire. Okay, keep away from flames and sparks. Use warning signs, oxygen in use. Then check equipments regularly. So suppose, imagine in emergency you are going to connect oxygen to a patient, and all of a sudden you have seen that there is no oxygen in the cylinder. So that is not the right thing. So before to that, everything should be checked regularly. Then avoid petroleum based products and maintain humidification if required, because dry oxygen may leads to leads to bleeding, or it may get cuts. Okay, it will dry the area. So today we have learned that what are the different ways why we will give the oxygen to the patient, what are the different ways or different types of mask required, and how much percentage which mask give, and the precautions to be taken. Okay, so effective oxygen therapy improves oxygenation, relieves respiratory distress and saves lives. Assess first. Carefully assess the patients before starting oxygen therapy. Choose the right device. Then monitor continuously. Ensure safety and provide quality care. So these all things we have to do to give a comfortable and easy and helpful to the patient, so that they can easily breathe and it will help them to recover. Thank you.